All right, good afternoon, everyone, and welcome. We are so excited to be here with you today to talk about certified community health workers, how to become a certified community health worker, how to become a community health worker, period, if you're not one yet. So we've got some exciting information for you all today. My name is Erin Rideout. I am on the coordinating council for the Community Health Worker Association of Delaware. I'm also a manager at Christiana Care's Community Health Impact Team, and I'm joined today by Christy Handley.
Good afternoon. I'm Christy Hanley. I'm a senior consultant with PMG Consulting, and I'm also a project director on all workforce and CHW initiatives through the Sussex County Health Coalition.
Great. Christy and I are going to guide you today through our discussion, and we're so pleased that you're all here today. There will be time at the end, plenty of time for a Q&A, and so any questions that aren't answered live will also be made available through the chwadelaware.org website shortly after, along with a recording of today's presentation. We also really encourage you to explore the website afterwards for more information and helpful resources. And then we'll also be able to, share our contact information. We'll share it again at the end. It's here at the bottom of this slide. But if you have any questions afterwards, please don't hesitate to reach out to us. We're happy to continue to support you in taking your next steps to becoming a certified community health worker here in Delaware. Next slide. This is our agenda for today. It's an outline of what we'll be discussing. We've designed this webinar to be as informative as possible for those of you who are interested in becoming a certified community health worker. And if by the end of this webinar you're thinking that maybe this role isn't for you, we encourage you to think about who among your colleagues or your friends or family network connections that might want to hear this and might be a good fit. So you could share this information with them. We'll kick off today's presentation with information about the association that makes this work possible. Next slide, please. So the Community Health Worker Association of Delaware was developed in 2019 by community health workers for community health workers and with the community in mind. Collectively, our membership represents over 35 diverse organizations, agencies, and sectors statewide, and our coordinating council members have a combined experience of over 21 years of supporting our neighbors and communities and helping them reach their full potential. The association's mission is to collectively advocate, empower, educate, connect, and support our communities to ensure health equity, social justice, and optimal well-being. CHWs are really passionate about the physical, social, and emotional health and well-being of all the people they work with throughout Delaware. And our association really strives to drive change through our advocacy efforts, our resources, and our training committees. I'll take a moment to also recognize the amazing coordinating council members who I get the privilege of working with, whose expertise and experience comes together to really expand the impact of the association in the state of Delaware. We've got Maite Eros as our chair, Delcy Morales as our vice chair. We have filled the vacancies that are listed there. So Erin Capel is our treasurer, Nivea Brown, secretary. I'm advocacy chair. Nani is our training committee chair, Denise for resources. And then we've got two communications co-chairs, Ama Ampansa and Monique McMillan, and then two at-large members, Adriana and Catalina. I'm going to turn it over to Christy to talk more about CHWs.
Great, thanks, Erin. We're going to review what it looks like to be a CHW in Delaware. We're going to go over some of those roles that you might encounter in your way. So let's start with what is the definition of a CHW. And I'm not going to sit here and I'm not going to read everything on this slide to you. I'm just going to briefly go over what it means to be a CHW. Basically, when you think about a CHW, you're a guide. You're helping people find their way through our healthcare and social service systems. You're bridging that gap between those systems and the communities in which these individuals live. You are building trust with these communities because you are generally from those communities. You know the local culture. You may speak the language of the individuals that you serve. And it's truly important to build that trust because these individuals rely on you for the support their family needs to survive. You're also empowering others. And what that means is you're not just doing things for people. You're not going to just, make sure that you fill out all the applications or you set them up with everything that they need. You're actually going to give them the tools to do it themselves and succeed on their own. And then, like I said, you do know their community. You may come from that community. It's really important for most of our CHWs to understand what the cultures look like within the communities that they serve. And you actually make people feel very heard. You ensure that every person within those communities feel respected and understood, whatever that might look like. And you work everywhere. What that means is you are in hospitals, you're in clinics, you're in community-based organizations, you're in state offices, and you're in local nonprofits throughout the state of Delaware. Next slide. So how do you become a member? If you're interested in becoming a member of the CHW Association of Delaware, we encourage you to just go in and visit the site, which you can see here on the screen, or contact a supervisor to get started in the process of becoming a member. On the website, you're going to find a form that you can begin filling out. And as a CHW, you'll be an advocate for health equity and social justice along with your fellow CHWs, those allies that exist within the association, and partners that are committed to educating, empowering, and supporting your communities. Next slide. So let's review what some of those key responsibilities of a CHW might be. You may be out there doing some outreach. You may be doing some education. You may be doing advocacy or resource navigation. Whatever that looks like for the organization that you are working with, you will be helping your communities thrive. You're going to connect all of those support systems to individuals. You're going to assist them with learning about the many resources that are available to them, and you're going to advocate for their health and wellness needs. Next slide. Some of the core responsibilities that exist for CHWs may look like, doing cultural mediation among individuals within communities. We know this is extremely important in today's world. You may be doing care coordination and case management. You may be working with a care management team at a hospital or within a health system. You may be advocating for individuals and communities in getting better health care in their area or getting transportation. We know that that can be a challenge in Sussex County. So maybe it's helping advocate for better transportation in their area. Providing direct services or conducting outreach. That may look like you going to an event and tabling at an event and providing information to individuals that may be there. And you may be able to support them with some resources while you're there. Providing some culturally appropriate health education and information. Again, that goes with outreach. Providing your coaching and social support. Building individual and community capacities. Implementing individual and community assessments. You may be going out and doing assessments and seeing where their needs are. Where do you need to refer to? And it also provides a really great background piece of information for those sources that you're referring out to. And then you're participating in evaluation and research. So some of the core skills that you will need to be a community health worker are you're going to need really fantastic communication skills. It's important for you to be able to not only speak appropriately to your clients, but it's also important for you to listen. Listening is going to be a skill that you're definitely going to need in this industry. Interpersonal and relationship building skills. Again, that comes back to some of those listening skills. Service coordination and navigation skills. What does it take to do or to get them into the resources that they need? Education and facilitation skills, advocacy skills. We reviewed that a little bit. Building individual and community capacity, individual and community assessments. You may go into a community and do a complete, we call them landscape analysis, but you might do an assessment and say, this community needs X, Y, and Z. And you can go out and you can advocate for some of those. Outreach skills, professional skills and conduct. And if these are some of the things that you need assistance with, there are definitely support systems to help you grow in these skill sets. Evaluation and research skills and your knowledge base. Next slide.
Thanks, Christy. And some of those skills might be things that you're already really good at, right? And for the ones that you're not, like Christy said, there's training, there's support available to kind of build your comfort and confidence in the ones that maybe you're less comfortable or confident in. Um, we know that CHWs in Delaware have helped provide the Delawareans they've supported with resources, a better understanding of the health and wellness services in the state. Through this work, we can proudly say that there have been improvements in preventive care, reduction in hospital readmissions, and there's just the continuation of addressing the social drivers of health and the vital conditions that people need to live at their full health and wellness. And not only do CHW support Delawareans in their health needs, but also they work to improve the quality of care kind of statewide through various initiatives. And when you think about like improving preventive care and some of the skills and main roles that Christy just talked about, right? That's helping people figure out, oh, you don't have insurance? Let me help you get connected to insurance. Let me help you get connected to a primary care home. Oh, you can't get to your appointment? Let me help you figure out that transportation, whether that's getting on the bus or figuring out a ride share or tapping into their social network, right? That might be able to give them a ride. So really just kind of managing all the things that are occurring outside of the health system that help get people into the door to get that preventive care. And when you're thinking about kind of that hospital readmission, helping people understand what their doctors are telling them. So often you get sent home with a very long or complicated even discharge summary or discharge instructions. And community health workers really help break that down into kind of straightforward, easy to follow steps for the people that they're working with so that they can do those follow-up treatments, do those follow-up appointments, and are less likely to then need the hospital or need to run right back into the hospital for care. Next slide. Now we're going to move on to the why, right? Why should you become a community health worker and what's available to help you get there? When you become a CHW, you're really taking on the role of becoming a trusted member of Delaware's communities. You're addressing those social drivers of health, and that's really something to be proud of. Many CHWs find that they are called to this work because they're already supporting their family, neighbors, and friends around health and well-being. Christy and I hear that a lot, right? People are like, well, I've already been doing this, right? I've already been talking to my grandfather about his diabetes, right? I'm already helping him get to his appointments. I'm already helping him understand what the doctor is saying. And that's why CHWs are so amazing because often you're coming into this job, you're already a trusted member of the community you live in. And that allows you to make just a really unique impact for the people that you're working with. And as a CHW, you can help reduce those healthcare costs that people face, right? Healthcare is expensive. And so if you're able to help people connect with that primary care, that preventive care, you can lower their overall healthcare costs and what they're having to spend because they're not using those emergent services or like the ED or urgent care. You're also helping improve their kind of experience with both the healthcare system and social service systems, community service systems. Those systems are hard to navigate. And so as a CHW, you can help people kind of make those connections that they really need and make their experience with those systems much improved. And as a CHW, you'll be able to achieve a sense of really personal fulfillment by helping the communities that you live in and you work in become healthier, building people's kind of personal wellness skills, as well as being able to advance your own kind of career opportunities and the connections that you can make. Next slide. So there's a few different training providers in the state. This slide shows the training opportunities that are available in Newcastle County that are upcoming, as hosted by the Division of Public Health, which is one of the state's approved CHW training providers. And these trainings are all in person from 8:30 to 4:30, and you can kind of see that the dates are kind of broken up, but it's usually about 2 days a week. Next slide. And these are some additional training opportunities, again, through the Division of Public Health, located in Kent and Sussex County. And these trainings through the Division of Public Health are free. And there are additional training providers that Christy's going to touch on, but there's some virtual trainings through PHMC called CHW Core, and Delaware Technical Community College also offers a CHW certificate program. Christy?
Great. So thanks, Erin. Yes. So if you have a challenge with getting in person, then we do have some opportunities for you to go virtually, and you would just need to connect with the Sussex County Health Coalition to get you linked in with some of those virtual PHMC or CHW core trainings, and some of the other wonderful specialty trainings that we may have as well for our community health workers. One thing I'm really excited to talk to you all about today is the apprenticeship program. Back in 2022, one of the first things that I was tasked to do when I came into this position was to build a apprenticeship program for our community health workers. It did not exist until then. So I worked with the Department of Labor, and between myself and the Department of Labor, we were able to launch our very first CHW apprenticeship program in May of 2023. What this program does is it utilizes what we call an earn while you learn model, which basically means that apprentices are receiving a paycheck while they're gaining all of those valuable skills through hands-on and on-the-job training and structured classroom instruction. Our curriculum requires 2,000 hours of on-the-job training in addition to core educational training. And what that core educational training looks like is one of those educational opportunities that Erin and I spoke about just a few moments ago, in addition to health literacy training. And that is something that is, those two items are required. Those are your two educational training programs that are required for your apprenticeship. At the same time, you will be doing your 2,000 hours of on-the-job training with whomever your host site will be. And that would be your employer that we would place you with. In each month, we make sure that we touch base with you. We make sure that you feel very supported, and that you are also getting the resources you need to succeed in the job that you're doing for those that you're working with. I would like to point out that our program, we just found out a few months ago that out of 426 statewide apprenticeship programs in the state of Delaware, ours is ranked 13th. And we are super excited about that because it is growing and people really, truly love the work that they're doing through their apprenticeship program. Next slide. We can talk a little bit about what the benefits of an apprenticeship program look like. For an apprentice, it looks like a clear career pathway. It gives you that opportunity to get paid while you're learning more about the community health worker career pathway. You're provided with lots of mentorship through your employer, but also through the Sussex County Health Coalition, who is the agency that works at like a liaison between the Department of Labor and your employer. So we're there to support you. We're also there to support the employer as well. You have lots of opportunities to grow in your skills for advancement purposes. We also know that you can come in at a certain wage and then we can see a gradual progression of wages. We have community health workers that have gone in at $15 an hour, but then they're coming out at anywhere between $19 to $25 an hour. So it really is based on how you perform during your apprenticeship for the employer. And the key is for you to stay employed with this employer. Once you're completed, we want you to stay there. And the benefit to them is that they're getting an employee who is now highly motivated because they've started at one salary and they've moved up. But they also are getting someone who has enhanced productivity. They reduce their recruitment costs, and they have lower employee turnover rates. The other benefit to employers is that they are skilling you, the employee and the apprentice, in exactly what they want you to know. They're building an employee around their exact needs, which is extremely beneficial to them. When you come out of this apprenticeship program, you actually come out with nationally recognized credentials. So if you think about this whole process, and Erin's going to get into this in just a few minutes, you will not only come out as a certified state of Delaware CHW, you will come out as a health literacy specialist, and you will come out with your nationally recognized CHW apprentice paperwork. Just like someone who is in HVAC goes into apprenticeship and comes out with nationally recognized credentials, you will do the same thing. Next slide.
Thanks, Christy. Yeah, that's an incredible opportunity, and Delaware is really lucky to have that additional training pathway. So kudos to Christy and the Sussex County Health Coalition for getting that set up. Next, we're going to talk about what Christy just teased us on, right? Certification. So, certification is one of the ways that we really look to establish more sustainability for the community health workers here in Delaware. Next slide. Certification allows community health workers to develop standard skills and roles, achieve professional recognition and workforce quality, and can make finding employment and stepping into new CHW roles easier. The CHW Association, the Division of Public Health, and the Academy have all collaborated to really ensure that certification aligns with national standards. So the Academy supports the association as we review the training curriculums for those approved training providers to ensure they align with the C3 Council's nationally recognized core skills training items. Certification is also really critical on our road to reimbursement. So that's, CHW services being able to be reimbursable through Medicaid, because we know that the Division of Medicaid will tie any future reimbursement, as we hope to establish it, to certification. So it's setting you up to be really marketable as somebody who could be reimbursed through Medicaid. Next slide. And so here in Delaware, like many states, the certification process is a voluntary process. And there's a really great value in promoting this voluntary certification for community health workers. The certification not only defines the scope and standards for CHWs in Delaware, but also ensures that CHWs are able to focus on the non-clinical social drivers of health that can really guide them in their work and make them an asset to any community-based organization or healthcare team. And these future efforts in certification might involve some specializations, right? Whether that's specialization in health literacy or trauma-informed care or opioid awareness, just other additional certification specialties might become available to help us better advance population health as part of our overall goals and work. We believe that such standardization really better positions community health workers in Delaware to reach their full potential as a workforce. And here in Delaware, we have four approved CHW trainings, and those are listed at the bottom in the orange boxes. So the PHMC CHW Core Training, Delaware Technical Community College's Certificate Program, the Division of Public Health's training, which uses the Institute for Public Health Innovation, IPHI's curriculum. And then we've also had the Penn Center for Community Health Workers through their impact model train folks as well. And the association is working on approving additional training providers. Now that certification is launched, we anticipate there'll be additional options for everybody so that CHWs can pick what works best for them. And so these trainings are really linked to our standard pathway. So if you have completed one of these trainings, you've got your certificate from one of these trainings, you can then apply for certification. And so to do that, you just need to be 18 years old, live or work in Delaware, and confirm your commitment to the CHW Code of Ethics, and then submit your certificate that you've obtained through one of these trainings. The other pathway for CHWs is a temporary pathway that'll be open through June of 2027, so the first 18 months of certification. And this is our legacy pathway. The legacy pathway is for community health workers who haven't completed one of the core skills training, but have been working as a CHW, right? So they've got that experience in that role. And so if they've got a minimum of 2,000 hours of paid work or volunteer experience as a CHW from the last 5 years, they can complete the Legacy Pathway application for CHW certification. And when you do that, when you fill out that application, you put in your employer's information so that they can then sign off and verify that you have done the amount of hours you've said that you have done within the dates that you have provided in a CHW role. Your title does not have to have been community health worker, but your role is in those core skill areas and core roles that Christy outlined earlier. The CHW certification for both pathways is the same, and it lasts for 2 years. So No matter which pathway you go through, you're certified for 2 years. And then at the end of that 2 years, you would get recertified by showing proof of your completion of 30 hours of continuing education, two of which must be in ethics. And so the association provides a number of free training opportunities that CHWs can attend virtually. Or in person, synchronously or asynchronously. So there's recorded webinars you can watch, there's live webinars you can attend, there's an annual summit that has a number of training hours. And so all of these training hours are really accessible and available so that it is not a burden for CHWs to be able to stay up to date and then maintain their certification.
Thanks, Erin. And Erin and her team on the advocacy committee have worked really hard to get certification through in Delaware, and they deserve a lot of kudos for all of the work that they have done. And we're very much appreciative for that work. Now we just need to advocate for reimbursement for our state. So let's talk about pathways to sustainability. What does that look like? So currently Delaware, the way that they fund CHW programs generally is through time-limited grant-funded financial support. So that means grants that may come in for a year or 5 years or whatever that may look like. That is how a CHW is funded for their organizations. Unfortunately, this model creates some challenges and consistent funding opportunities and program because what happens is we're placing community health workers into a community where they're making a really big difference. Funding runs out and then we don't have a community health worker in those organizations any longer. So we really need to advocate for these sustainable pathways and for reimbursement in our state to continue the good work that our community health workers are doing. To show Delaware's commitment to health equity, funding for the community health workers really should be supported through our state Medicaid program, our health plan coverage programs, and funding for our Community Health Worker Association. We can also find a pathway to sustainability through our apprenticeship programs, which we've previously discussed. So we definitely would love to have you join us in the journey of community health work and advocating for pathways to sustainability. Before I turn it back over to Erin, I really would like to quickly let you know I used to be a community health worker before they were even called community health workers. And that job to me was probably one of the best. And I don't even like to call it a job because it really wasn't a job. It was fantastic. I got so much out of the work that I did. I actually did it in hospice care, which is very difficult, working with families who their loved ones were extremely ill, chronically ill. And I have to say, bringing families together at some of the most crucial times in individuals' lives was beyond some of the most amazing work that I was able to do. But also making sure that these individuals had what they needed to sustain a fulfilling life at the end of their life. So maybe it was getting back and forth to doctors, or maybe it was getting back and forth to other appointments. Maybe it was going to see their family, whatever it looked like, or making sure they had food on the table. I had one individual, she couldn't get to her appointments because she was so exhausted because she had no food in her house. So making sure she had food and transportation and support and she wasn't lonely, that was really key to making sure that she was able to live a fulfilling life until she passed. So I truly enjoyed the work that I did, and I would tell anyone that this is probably one of the most fulfilling opportunities that you will ever have. So I'm going to turn it over to Erin.
Thanks for sharing that, Christy. And we hear that a lot, right, from CHWs who are working in a lot of different situations or different agencies. So Christy talked about hospice, right? We know CHWs also work at health hospitals, fairly qualified health clinics. And then Christy mentioned earlier, like smaller nonprofits or community-based organizations where CHWs are also making just really invaluable impacts. And so kind of no matter what your area of interest is or specialty is, there's probably a CHW position that would be a good fit for you. At Christiana Care, we've got CHWs who focus on, food as medicine, so looking at nutrition, food access. We've got CHWs in maternal health, so helping people who are pregnant or who have just delivered. In behavioral health, right? Supporting people get to their mental health or substance use care appointments. So there's a lot of options. Child Inc. has a domestic violence community health worker program. So they're CHWs and they're domestic violence advocates, and they're really out there meeting these kind of unmet needs. CHWs are just incredible, and it's because of their unique skill set that makes them so kind of adaptable to different positions, and they're just so needed in all those different areas. Next slide. So this again is our contact information. So you can use that to connect with us with any follow-up questions you might have. If you're wondering about kind of a specific program and you want us to connect you to somebody, let us know. But at this time, we're going to dive into our Q&A portion of the presentation and hopefully address some of your questions. So if you see the question and answer, the Q&A little icon. You can put your questions in there. I see we've got 3 already. All right. So the first question is, I completed a training. Does that mean I'm certified? So if you've completed one of those CHW core skills trainings, again, through the Division of Public Health, the Penn Impact Model, PHMC's CHW core training, or gone through Delaware Technical Community College's CHW certificate program, that doesn't mean you're certified. You might physically have a certificate, but you're going to submit that certificate through the certification application. So then you'd be eligible for that standard pathway we talked about. It's a really straightforward application, and you would kind of upload a copy of your certificate. Some people just snap a picture, some people scan it. It all works. Just upload an image of that certificate, and then that can get you to become a certified community health worker. Let's see. The next question, what's my first step to becoming a CHW? I'll start us off and then I'll hand it to Christy. I think there's a few different first steps. I think, always when you're looking to start into something, talking to someone who's already doing it, right? So get connected to a community health worker, come to the Community Health Worker Association's roundtable meetings. They happen every month. You can kind of hear what's going on in the CHW world here in Delaware. Attending one of those trainings, signing up for one of the trainings through the approved training providers is a great first step as well. And Christy, I'm sure apprenticeship, right? Could be a good first step.
Definitely. So if you're interested in becoming a CHW, like Erin said, definitely talk to someone who's been in that position or is in that position currently. Maybe ask if you can job shadow for a day or so. Go volunteer at some of these community-based organizations. That's a really fantastic opportunity for you to see if this is the kind of work that you want to do. But to get involved in the apprenticeship program, all you have to do is you want to be a community health worker. And what that means is you're going to go through some trainings, which Erin went over in great detail. We're going to put you through health literacy training, and we're going to match you up with an employer. If you're not already employed, we're going to match you up with an employer that will accept an apprentice.
And Christy, there's another question in the chat that I'm going to bump right back to you. What's required? How do you get started in an apprenticeship program specifically?
So really what's required is that we have to have an employer that is willing to take an apprentice. So that may be, I'm just going to throw someone out there, a hospital system like Christiana, like Erin worked for. I would say, Christiana would say, yes, Christy, we would like to have an apprentice. Then we have an application process that we go through at Sussex County Health Coalition. You can go onto our website for CHWs to complete the application. Let us know that you're interested. We would get you linked into what training programs that you have the opportunity to attend. You would then be matched with your employer, and we would get the paperwork rolling from there.
Great. Thank you, Christy.
Mm-hmm.
Another question, will this webinar recording be emailed out, made available? I'd love to be able to review and see what first step or path makes the most sense for me. Yes, so this webinar was recorded and it will be posted on the CHW Association's website. So again, definitely go to that website. There's a lot of great resources and information there, but then this webinar will also live there, and please share it out with folks that maybe missed it. Or if people say, hey, what's this CHW thing? Is this appropriate for me? You can let them know that there's a recorded, webinar that they can watch. And another question, does this webinar provide a certificate? Um, let's see. I don't actually know the answer to that question. Do some of our host friends know the answer to that question? Do you get a certificate for attending today?
We could definitely check and we can put that out on the website.
Um, Yeah, so this webinar was informational and so less kind of around the educational component. So you might just get an email confirming that you attended and like a thank you for attending. That might be the information that you get. But if A, B, and C is still on and they want to answer that question either in the Q&A or in the chat, that would be great. Any other questions? Okay. So again, go to the website. It's listed right there. It has information on certification. It has information on the trainings. It has information to join the association. Again, joining the association is a great way to get involved. There are free monthly meetings where we provide resources and education and information that's relevant specifically to CHWs. The association also hosts monthly webinars. So trainings that relate to what CHWs do are offered for free on a monthly basis. There's an annual summit that is usually really just so great. And we're going to start planning it in April. You can get involved. You can even get involved in planning that. So there's a lot of different ways to get involved, but the main thing would be click on that link, join the association, and reach out to us via email if you have any other specific questions. But thank you so much for spending your lunch with us. We really appreciate it.
Have a wonderful day.